Hello everyone, I am Dr. Pradeep. I am a psychiatrist. Today I will be talking about how to prevent suicide. First of all, why suicide rates are increasing. Globally, about 8 million people commit suicide. That is one suicide every 40 seconds according to statistics by World Health Organization. Is India far behind? No. In fact, India has the highest suicide rate in Southeast Asian countries. What are the risk factors for suicide? One of the most common misconception or myth is most of the persons who commit suicide or attempt suicide are because of psychiatric illness. Unfortunately, it is not true. In fact, a negligible part, probably 10 to 15% of patients with psychiatric illness go on to commit suicide. The rest are all because of various other psychosocial factors and environmental factors. Most common risk factors are in adolescents, adolescent girls, that is, gender of being a female. They have more propensity to attempt suicide. However, adolescent boys can complete suicide. The geriatric population, the other end of the spectrum, have high rates of suicide completers. Being widowed, being divorced, being unemployed, being in an urban metro, having a psychiatric illness, having comorbid chronic illness in the form of stroke, in the form of paraplegia or cancers, or having HIV, or having comorbid substance use disorders are all risk factors for attempting suicide. Please note, suicide is not reported adequately in the country. For every person who completes a suicide, there are probably 8 to 10 of them who attempt suicide. So, the numbers that we have are just the tip of the iceberg. Suicide is preventable. In order to prevent suicide, we must first identify the warning signs for suicide. Person may be having verbal signs like talking about ending life, talking about feeling guilty or having committed a sin, talking about feeling trapped or in unbearable emotional pain, talking about feeling hopeless or having no reason to live, talking about being a burden to others. Person may be saying things like, everyone in the family would be in a better place without me, or people would probably understand my importance when I'm gone. Writing stories and poetry related to death in their social media profile and journals. Person may be saying, life is pointless, I wish I was never born, I'm so tired of living, I can't take it anymore. Behavioral signs. Outgoing or social persons' interaction with family or friends decreases or stops completely. Person may be restless, agitated, anxious, feeling sad and dejected, sleep disturbances, eating less or more than usual, withdrawing or feeling isolated, staying aloof even from family members. This happens because they feel that nobody can understand their situation. Extreme mood swings, substance abuse, giving away belongings, collecting medicines or pesticides, writing a will, disposing of property, talking about seeking revenge. So what we need to do? We need to get help. Find out people who are a part of or are willing to be a part of the patient's support system, such as family members, friends, psychiatrists or co-workers. Involve them in taking care of the patient. There are suicide prevention helplines in various parts of India. Their contact details can be easily found on the internet and many of them function 24/7. Volunteers or employees working with them are experienced at counseling suicidal patients and helping them effectively till you can take them to a psychiatrist. Don't leave the patient alone. This is undoubtedly the most important point. We dismiss the issue if someone says they're feeling suicidal, because we believe it's just empty words. But in reality, nearly 60 to 70% of people who commit suicide give hints before dying by suicide. So we need to take it seriously if someone exhibits any such behaviors. Constant supervision is needed till you meet a psychiatrist. Supervised food and medications are required. Keep sharp and harmful objects away from the patient. Thank you.